presenting?
Denise, no.
Why is it not sharing? Let's try that again. Bismillah. Okay, let me get out of here, guys. Technical difficulties. Sister Miraj, you might have to open yours up because for some reason now mine is frozen.
Okay.
Oh, you could see it. Oh, Jazakallah khair. All right, yeah, because I was trying to present it. For some reason, it's not presenting. Okay, so this is our back to school COVID-19 reopening plan that the team has sat down and mashallah tabarakallah has worked overtime to make sure to ensure that everybody who walks into the building is safe, inshallah. Go ahead, Sister Raj. So first and foremost, the CDC guidelines, the Texas TEA, and any of the health services that surround our areas, we will make sure that we are closely monitoring it and getting our information from them. Keep in mind, things always change, right? So this is not set in stone. Inshallah, we don't want it to tip into something drastic. We want to make sure we stay away from that, but it is our duty and for us to make sure that everybody is well equipped with the knowledge that we have to keep running the school and keeping you guys safe. I kept this tip here for everybody. For your knowledge, guys, make sure you are able to look on the CDC guidelines as well. I don't want you to feel like this is only a teacher/school thing. You're absolutely welcome to check the CDC guidelines along with us so you can be safe and informed in your own home and communities as well. Okay. All right, so one of the big things that is added to the CDC guidelines is that everybody who walks into the building, which is developmentally appropriate, should be in mask, no exceptions. If you wanted to visit for 5, 10, 15 minutes or so, please wear a mask, please bring it. We understand that it might be a hardship for you, but we are following these guidelines. The only time you should be able to take that off if you need it is by eating, drinking, and even in the switching of your mask, because we do encourage maybe, when things get moist to switch out your mask. So please, inshallah, anybody that walks onto our campus has to have mask at all times. Okay. We included the hand sanitizers. We want to make sure that you're aware that we do have hand sanitizers all around the buildings. We have specific areas that when we enter and exit the buildings, the hand sanitizer are available. There's hand sanitizers in every room that you might go into or which is occupied. And again, please contact your teachers to find out what their classroom management's regarding the hand sanitizers, etc., in their classroom. Our biggest thing here is what happens if there's something on campus. So I'm going to address 3 different kind of scenarios that we put into place. So inshallah, just give me enough time to speak and then we can answer questions later. So at this point, if you do have questions, go ahead and address it in the chat. I might be answering it on our scenario check. So inshallah, again, this is what we're going to do. This is our protocol that we set up for RSA that follows, again, our CDC guidelines, and that's beneficial for both parents, students, staff, and anybody that walks into the building. First and foremost, we do have an isolation room in our campus, and we also have 2 trained staff members who is able to administer a rapid COVID test. Alhamdulillah, they're trained in it. We got it from TEA, so we have these rapid tests that if inshallah, nothing will happen, hopefully, inshallah, but if something does happen, with your permission, consent form signed, that we will be able to administer these tests. Our isolation rooms, once a person or a child enters this room, nobody is allowed to go into it unless they are fully equipped with their PPE, their personal protection equipment, which we do have, which we have our staff I think Sister Sherry and Sister Mirage, mashallah tabarakallah, they are saying they was going to be the only ones that would be entering in and or leaving this area. Nobody else is allowed to go into it until the appropriate designated parent or guardian will be picking up these children.
Please go ahead and mute yourself. We appreciate your cooperation. If you just entered the meeting, please go ahead and mute yourself. Thank you.
Okay, Sister Raj, go ahead. Oh, go ahead. All right. One of the big things we want to make sure you understand before I get into the scenarios that with our trained personnel, you know, they're going to be the ones that's going to be dealing with your kid outside of our classroom once they leave our classroom, if they had any symptoms. Now I put this picture here so you can understand what's happening. If a teacher or anybody or the staff notice something off with your child in the sense of coughing, shivering, any of these major symptoms, we will contact admin. They will be removed. We don't know whether it's COVID or just a regular cold or cough. Anyways, any of these symptoms, we will be moving the child into isolation room at all times. So after that, so these are our steps here, but I'm going to get into detail because it's just very minimally said here. But again, I want to make sure you understand this here. If your child is okay from your car, once they enter the school in their classroom, and when we notice any of these symptoms, major or minor, we will contact admin to move them immediately out of the classroom. I want to make sure you understand that. So even if they said, I don't know, they just have a cough, you know, maybe they got a sore throat, we will move them out of the classroom for everybody's safety, and we will start taking our steps that's necessary, which we're going to deal with here in the next part.
We'll modify to grade level, will be modified to.
I'm so sorry. Can you mute? Thank you. Go ahead, Sister Raj. Okay. So now I'm going to go into my scenario. So you have to understand, if a teacher herself or himself and or student exhibits anything other than what, you know, quote, their healthy status is, again, we will remove them immediately from the classroom, and they will enter isolation room, no question asked. Okay, so now I'm going to go through this here so you can understand. So I want to make sure at this point that you guys are with me here. So once they're in isolation room, right? So this is what's going to happen, whether it's high risk or low risk. We will contact the parent immediately. Now, this is the point where I want you to understand. Once you get contacted, you have a choice whether you want RSA staff to conduct a rapid COVID test, or you can opt out. So I'm going to talk about those choices there. Now, if those are the two choices, what comes next? So this is what we're going to go next. So this right, you know, the screen that you're seeing right now, this is if and or this is what happens. Okay, so anything that happens, whether they are, quote, not, you know, just feeling a little bit sick and or something is really going down. These are our steps. So let's go. Say we have a symptom, we move them into isolation room. What comes next? Go ahead, Sister Raj, just go to the next screen. Okay, so now you tested, you said, okay, Sister Raj, or whoever, please go ahead and give rapid COVID-19 test. If that child's tested negative, let's go with the negative first, okay? If the child has tested negative, again, remember, they're already in isolation room. We will contact a parent. Oh, I'm sorry, let me flip this right here. So, because it does say positive. Let me start with this, I'm sorry. If the child is tested positive on the COVID test, they will be sent home at this time. The parents will be called, sent home, no question asked, okay? So what happens to the rest of the classroom? Okay, the classroom will go into a lockdown. The parents will be contacted, everybody in that stable group. So I'm going to use the stable group because I want you to understand is your child will be within that contained classroom, you know, with the teacher and They're students for this whole year, right? So I'm gonna call it a stable group. So that stable group's classroom will be on lockdown. The parents will be notified. Everybody will be picked up and will be basically self-quarantined for 7 school days without including the weekend. So once that occurs, the virtual homeschooling will happen. So let me say this again. A child is sick or fever, or the teacher is not feeling good. They take the COVID test, it's positive. Those persons who are tested positive will be immediately removed from the campus. That particular classroom, that stable group will be in lockdown. Parents are being contacted. They are, led aware of what's happening. They pick up their kids. That classroom, will be in quarantine. They'll be going through an extensive cleaning. Nobody will be entering in that classroom for those 7 days. And you, the parents and child, will begin the virtual homeschooling from home. So everybody in that classroom will experience that. Okay, so let me jump off, Sister Marge, let me jump up to the other one. I'll go to scenario 3. So that's scenario 2. So let's go to the next one. If that same child or teacher took the rapid test and it was negative, okay, what happens is we will still send them home, right? They will be expected to basically heal and recover from whatever they do have, and make sure that they're able to return to campus after 72 hours after their symptoms improve. So maybe you just had a cold or some kind of flu or whatever, right? Again, the test came out negative. The parent is called, they're removed from the classroom and from the campus, but also the teachers will make sure that the area has been wiped clean and taken care of. Okay, so far. Now, let me go back to that second screen. I know I'm jumping around, but I want you to make sure you understand what's happening. So if it's COVID, Sister Marge, go to that next, the previous one. Yeah, one more. So if the child is positive, everybody is removed from the classroom. We'll go home and experience the quarantine for 7 school days. And they have to make sure they're not exhibiting anything else before they come back into school. Okay, so let's go back to the child had some symptoms, whether it's minor or major, and the parent opts out. They said, I don't want to take the COVID rapid test. So we don't know, right? We don't know if it's just regular sickness or something else. We will treat this case as if it is COVID. We call the parents, you pick up the child, same thing, we will call the parents of the stable group. All of them will go home, right? And we will have virtual schooling from that point because we don't know, right? The parent opted out, we're not sure what's going on. Now, if the parent comes back and says, I don't know what it is, I didn't even go to the doctor, again, you're staying 7 school days because we're not sure. We're not going to take that risk, okay? But if you leave, you took a doctor's test or you went to the doctor and you had a notice saying, hey, it was just a flu or something. So again, you will stay home for the 72 hours and we will be informing, we'll be in constant communication with the whole stable groups class, whether we can return safely or not. So how about this? You opt out and you go to the doctor for said child and you told the doctor, I'm not going to take the COVID test. Now what? Well, we will treat it as if it is still COVID. You will stay away from school for the 7 school days, same as the stable group, because again, we don't know what the condition is. We'd rather be safe. So everybody in that stable group, including the child, will be home for those 7 days and making sure they're not exhibiting any of the symptoms whatsoever. Again, virtual schooling will be happening during those times. So here we go. You had a child who was sick in school. You had the 2 options, right? Whether you can take the test or opt out. Either way, you will be removed from the campus, whether it is a positive test or a negative test, okay? Or whether you opt out from it. Now, what happens if my child, mommy got COVID, unfortunately, right? We're requesting that you don't bring the kids to school. And I said kids, that's also including siblings. Stay in contact the school and say this is the case. And, you know, it depends on when you find out. So we can exhibit the whole 7-day process from the time you found out, so you can have that proper time to recover, Insha'Allah. Again, those, if it happens, say, for example, on Friday, or let's say, let me go Wednesday, you go home and you took a test, and you're like, okay, I have something. Contact us as immediately so we can make sure we take care of the class and everybody in that situation, because we don't want anything to spread or harm anybody, Inshallah. So go to that third slide. Wait, the next slide, I'm so sorry. So what happens? So the middle part says, you tested negative, alhamdulillah, you stayed your 7 full days, you took another test, and you're good to go, right? Everybody in your household is fine. Please make sure, you know, you understand you are able to return to campus. Now, if you stayed home from an illness or whatever, you took your 72 hours of time to heal, then recover. And this is the big thing here. We want to make sure you're symptom free without taking any like Tylenol or fever reducing medicine. Now, if you say, well, Sister Denise, my daughter and son had a fever, and this was at 7:30 a.m. and I gave him Tylenol, and can we send him to school? No, they have to be that fever free without any fever reducing medication. You understand, this is an honor system, folks, right? So if you feel like your child, I don't know, having a little bit of fever, maybe they're, you know, something's going on, do not bring them to school, and do not sit there and tell us that we gave them Tylenol an hour ago, so they should be fine. If that is said or done, we will not allow the child or parents into the class or campus at all. You will stay home, stay healthy, resume your time to take care of yourself before you bring them back to campus. So now, after you say you had COVID, you recovered after 7 days and you took your test, please, inshallah, you're able to come back, right? We want to make sure that you're able to come back and resume your daily activities. So these are the things that we're going to do to keep you safe. And I hope, inshallah, you kind of understand. So there's the 3 cases: COVID positive, COVID negative, and opting out. So these are the 3 actions that we take once somebody steps into the building. Now, side note, if a stable group heard, like parents heard that, and I'm going to use my class as an example. My class went to lockdown because there could have been a possible case. If you wanted that child to be tested on campus, please make sure you sign consent forms, and we definitely can make sure we can take the proper measures to at least relax your heart from something. So those are options for you. Again, if it's a positive case, the whole classroom will be locked down. The parents will be called immediately, right? There is no choice but to come to campus, remove your child. Remove your child, such a harsh word. Pick up your child, go home and spend that time together, recover together. You are absolutely able to do virtual schooling. So nothing is lost. So inshallah, hopefully these 3 actions for those 3 cases are understood. But I want to make sure you understand, I'm going to say this again. If you feel, or if your child has the sniffles, stay home, folks, stay home. I'd rather you guys recover. You might not like that, maybe your job or whatever, but stay home and do yourself that favor to just protect you, yourself, and your household, and everybody out. In that case, no one shames you for that. Take those sick days, just cuddle up, read a book or whatever. Just take that time away from school. We're very flexible. All our teachers, we have in the back of our mind expectation of virtual. So we want to make sure that it'll be a smooth transition for those days of recovery. No one is a superhero. So if you do get sick, take that time, inshallah, to recover. So yes, just real quick, because I want to answer this question. Yes, Sister Mirage, or the office, everybody in admin has those forms, whether you want to opt out from testing and or if you want to take the test. So either way, when the phone call happens, they will notify you of your options, inshallah. The last day, Sister Mirage, the last slide, inshallah, would just be the dua of protection, inshallah. And Sister Mirage reminded me we should have this here because we don't want anything to happen. And unfortunately, I can't read Arabic. So if somebody who is awesomer than me, can they go ahead and read this translation? Because I think it's a beautiful way to seek protection from something that we cannot see, inshallah.
Go ahead and say it, Sister Denise.
All right, Jazakallah khair. Yes, go ahead.
Inshallah. بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم. We say the dua, inshallah, 3 times in the morning and 3 times in the evening. So Allah subhanahu wa ta'ala protect us from all disease. So the meaning of the dua, subhanallah, we ask Allah Azza wa Jal from everything can harm us, either on earth or like subhanallah, it's coming from the sky. So and Allah Azza wa Jal, He is the all hearing and the all knowing.
Jazakallah khair. And just to remind you guys, all this is not set in stone. It can be changed, and we promise that we'll keep you in constant communication so you're well informed what we do inside of our classroom, what we do on campus. Inshallah, what we're doing is to protect you guys, your families, as well as my co-workers and my family as well, inshallah. So really, we are in this together. So please, inshallah, bear with us, right? Because we're all on this path together. This is brand new for all of us. I am not perfect, and neither is anybody online. So inshallah, we are constantly training ourselves to get to a place where you're comfortable. But again, this is an honesty policy. So again, I'm stressing out one more time before I let the brother talk. If you're feeling anything, just go ahead and stay home for your sanity and for the rest of us. Jazakumullah kulli khair, guys.
Jazakallah khair, Sister
Denise. Sister Mirage, go ahead.
Yes, I want to, as mentioned in the Cheetah Beats, we do have this year's theme, Stronger Together. So just bringing everything what you have mentioned will not happen without our team effort. Inshallah, I'm going to introduce Brother Bilal here, Dr. Bilal. Dr. Bilal is a clinical assistant professor, emergency medicine, board certified emergency and family medicine, director, education, wellness and care, Group of Texas, medical director of an urgent care. He likes to introduce himself as a philanthropist by passion and physician by profession and a teacher by heart. He served on ICNA Relief National Board for 4 years. Dr. Bilal, I gave you the screen share if you want to go ahead and start. Bismillah.
Thank you. Alhamdulillah Rabbil Alameen wa salatu wa salamu ala ashrafil anbiya wal mursaleen. Bismillahir Rahmanir Rahim. Nahmaduhu wa nusalli ala rasulihil kareem. So first of all, I would like to express my gratitude and real thanks to Sister Miraj and all the RSA administration for giving me the opportunity to talk at such an important eve of reopening of our school. Basically, mashallah, after 1.5 years, I think it was last March, so that we are going back in the school physically, inshallah. As Sister Denise, mashallah, already given a wonderful presentation, and she said we are all in this together. So really, this is we are all in this together, and this is this had become a joke that we are in the unprecedented times. And anything happening bad, anything is getting short, things are getting delayed. We are in unprecedented time. It's COVID, brother. You know it's COVID. So, but really, in the last few weeks, we see that just a few weeks ago, it seemed like everything is pretty good, under control. Everybody excited, go back to school. But then within the last couple of weeks, I would say 2 to 3 weeks, the things have hit back harder. I was reading yesterday an article, I think it was Wall Street Journal, that all over the country, the schools are exactly going through the same situation as we are going through right now, that the whole paradigm got like shifted to the other side. Then this side, now we're finding the happy medium where obviously nobody's closing school, nobody's going to shut down, but we have to find a way forward that how to navigate ourselves in the most protective way possible, yet not creating panic, yet not getting overly cautious. So there is obviously always a medium balance, as we know Prophet ﷺ mentioned that first tie your camel and then put trust in Allah. So obviously anybody can untie the camel and take it away, but you cannot keep standing with the camel whole night just to protect the camel. So you do your part, and then as mashallah, very beautiful dua, and the Sister Milad mentioned that it will be in the presentation. So I was thinking maybe I'll have to understand or memorize, but this is the dua which every time I go in the ER, in emergency, I do it. Bismillah alladhi la yadurru ma'a ismihi shay'un fil ardi wa la fis sama' wa huwa as-sami'ul alim. And that really gives a sense of protection, because again, nothing is in our hand. No matter how many masks we wear and how many PPE, at the end of the day, it's all Allah who can protect us and or who can test us. So having said all that, so this was a wonderful presentation. My wife is just coming back from Pakistan. She always makes presentations for me. So I have no presentation. Just before the start, I'm reading like many articles are coming, so everything. So I have no presentation to present, like as a slides, but I think what we should do is like just go straight to the questions. So any parents and any question regarding testing, regarding vaccination, and regarding treatment. For testing, quickly, I would like to touch base. This is a wonderful idea to do rapid testing in-house. The results come back, I think, within 10 to 15 minutes, and that gives us a first move forward. After that, I would like to offer parents that we do have an urgent care where we do have like a PCR testing. It's called Multiplex Test, which tests COVID, RSV, flu, because again, RSV and flu, they have been the major players until now. So still they will be the major players when we come back together, and there will be a lot of patients having RSV, which is respiratory syncytial virus, flu, and then strep throat. So whether you come to our urgent care or any other, I will definitely encourage anybody who gets the symptoms, stay at home, as Sister Denise said, or if the symptoms develop in the school and then you are requested to take the kid home. So please go ahead and go to any urgent care, get the PCR test. Even if it is like negative, I would say get another PCR test, because that is very sensitive. And if that is negative, then you are pretty safe. And similarly, get also the other tests done, flu, RSV, strep. So any of other things come up, COVID is negative, so you are sure that this is not COVID. So with that, I would just like request if any questions, we just start from there. Otherwise, I have a list of questions, common questions, but I want you to ask any questions.
If anyone wants to ask a question, please go ahead and unmute yourself or post it in the chat box. I'm trying to find if anyone is raising their hand.
There's one right here that says, does 7 days virtual school option apply to preschoolers as well, or just older classes?
We do, Sister Denise.
Yeah, I think it's like for everybody. And it's a 7 to 10 days. And then basically, so it's after 7 days, after receiving a negative test result, and test must occur within 5 days or later. So what happens is like, basically you got the symptoms, you got the rapid test pretty quickly, it's still possible that the result, like the symptoms develop a little later on. So that's why they are recommending that, take off 7 days and then go from there. And it's so so within 5 days or later, like before you come back, so it should be within the 5 days. Other than that, if you have no symptoms and after 10 days, you can come back as well, according to the CDC, or otherwise full is the 14 days. So you got the exposure, for example, then you watch yourself for 14 days. doing good, at least like for 3 days, no symptom at the end, no fever, 72 hours have gone. So this is number one. Number two, exposure, and then no symptoms in 10 days. So after 10 days without testing, or after 7 days with testing. So these are different options, 7, 10, 14.
Will there be a quarantine required for anyone who travels out of state? Is one of the questions. Any quarantine required for who's traveling from out of state before they come back on?
I think this is about, yeah, this is per the local board and like local authorities to decide, and I would say per the school. If school has any policy in that regard, Sister Miraj?
Yeah.
Yes, at overseas, I think they are required to be quarantined, but then virtual school is an option. From state to state, I'm not quite sure on that one yet.
Yeah, because from somebody coming from New York or.
Sister Miraj, also when they're traveling, sorry,
yes,
also when they're traveling, Sister Miraj, we will ask them to get the COVID test done if they're traveling from Maryland.
Yes.
So with the state to state, Sister Ghazala, we ask.
Yes, because if they're traveling from Louisiana, Florida, or anywhere, so I'd rather have blanketed that they have to present the COVID test.
Okay. So yes, to answer the question from state to state, yes, just provide a negative COVID test. So.
Sister Denise, did you get this question? Will parents be informed if there was a positive case during the class?
It is. We will let you guys know. Also, this one right here is a good one. If you opt in for rapid testing, would the staff wait for the parents present to perform the test? We can absolutely wait for you. The kids will be in quarantine the whole time. Now, you know, we don't want anybody to be fearful when they take the test. And alhamdulillah, again, we have trained professionals here. But if you feel comfortable, yes, you certainly can be there when the child takes the test. We're not going to shame you out there. The virtual school questions, we can address that together. I mean, let me go to COVID first.
Yeah,
if that's okay.
We'll answer that in the end.
Right, because I see a lot of them, what we're doing with the virtual school. I just want to make sure we cover the bases of the COVID first.
I think Dr. Bilal, if you want to take this one about vaccination for students.
Yeah, what's the question?
It says there was a survey done if there was, if their students were vaccinated or not. We were doing it to know and encourage the students to get it done if we have too many of no.
Yeah.
So
just I think
give us a scenario.
Yeah, so let's quickly go through a little bit about the vaccination, because obviously this is very important. So I would like to show this video about how vaccinations work. So let's see here. Can you hear everybody?
No, brother, I didn't hear anything.
No, you have to add audio for sharing. So you have to exit sharing.
Oh, okay. Exit sharing. Stop share.
Stop share. And then when you share, there is an option, select audio for sharing. So.
Share sound. Okay.
Yes.
Okay, share.
And are now approved to prevent COVID-19. Unlike some other types of vaccines.
Okay, can you hear me?
Yes.
Okay.
Do you want to expand your screen?
mRNA vaccine.
Okay.
Have been in development for 20 years and are now approved to prevent COVID-19. Unlike some other types of vaccines, mRNA vaccines do not contain any pieces of the virus. Instead, the COVID-19 mRNA vaccine teaches our own cells to make the quote-unquote spike protein found on the surface of the coronavirus, triggering an immune response. In short, they help our bodies produce antibodies specific to the virus, along with T cells that also confer immunity. That sounds great, right? But I bet you're thinking, how exactly does this work? Well, it works works by simply reproducing the same immune response that happens in a natural infection, but without actually infecting your body. Cool, right?
Okay.
You want to exit it? You have to stop
yeah.
share.
Oh, they stop share. Okay.
Yeah.
Okay. So yeah, so basically like this is one important question which comes again and again, that this vaccine was developed too fast, too quickly, without much trials to have been seen. So there has been an episode of Dairy about a woman who basically worked on that, and she says like it has been going on for decades. Since 1980, they have been working on this technology, which is how a messenger RNA that works on the cells to let them make the antibodies without putting the actual dead virus or bacteria as a vector in the system, like in the body. So that is called a messenger RNA technology. And so now the concerns about that, so one concern is like we do not have long, and then the thing is like being about that it is being approved by too quickly. So the thing is that they removed a lot of red tape, bureaucratic procedures in getting all the studies approved. So if anybody has experience, I don't know about like applying for grant to NIH for the researches, it takes years for the researchers to get approved and then get all the like money and all the funds. But in this case, all those the procedures were removed, and they directly jumped into clinical trials. Then what happened in clinical trials, that they followed pretty closely, and particularly talking about kids, Pfizer and Moderna, they followed 2,260 kids from age 12 to 15 and 12 to 16. And in both of those cases, it was found that it is 100% effective for symptomatic benefit. So there's a difference in that. It's still positive that all those vaccinated, if we start doing the tests, some may still become positive. But yeah, I got this question from Brother Gibran. I will answer that. So yeah, but from all those, like there was a question, there was a concern that there could be effects of the vaccination. So if we do the testing of all the kids or anybody who has been given vaccination, it is possible that some of them come back positive. But we are talking about symptomatic relief. So the symptomatic relief means that 100% of the patients who got vaccination in this age did not get any symptoms, even if they were positive. Number one. Number two, now they are following 4,500 kids from age 6 months to 11 years. So 6 months to 11 years, they are following 4,500 kids. And what happens is, there was an interesting article, I think in Wall Street Journal, that half of the kids are placebo and half of the kids get the vaccine, and then they wash them. Now, the other question comes that we do not know the long-term effects of vaccination. So that all of the vaccines so far, the bad effects come within the first 2 months. We have like long history of vaccination, which we know, smallpox, polio, which virtually eradicated many diseases, measles. So all the bad effects of vaccines come within the first 2 months. So we have already into 8 to 9 months, and there have not been any big side effects come up. Now, the question came from Brother Gibran about heart inflammation. It is called myocarditis or pericarditis. So there were cases reported, and there was concern that it is caused by vaccination, but there has not been any causal relationship established so far. Very less number of the cases. So what is happening basically is we always get myocarditis. So the myocarditis is not new. It happens in young adults. Just a few weeks ago, I had a young adult, like a 25-year-old gentleman came in when it looked like heart attack, basically. It was so bad. So, and we sent him to the cath lab, but it was myocarditis. And having the mean researcher instinct, I was thinking maybe it has like a vaccination. He had a vaccination and I can write a case report on it, but he was not vaccinated. So, and we always see myocarditis before, and we will continue seeing after this vaccination. What's happening is that because after the vaccine, we are not wearing masks, so we are getting other viruses, and other viruses that may cause myocarditis, and then it looks like so it looks like that it may be related with the vaccine, but there is no causal relationship established with myocarditis. But COVID itself can cause myocarditis, and there is big risk of patients of COVID to get heart attack, myocarditis, congestive heart failure. So it's always better to get vaccine than not get vaccine for this issue. Another question came up about pregnant ladies, and then there is another related with this is another myth, or what we say is conspiracy theory circulating that it can, God forbid, affect on the like fertility, infertility. So I was listening to a lecture from an epidemiologist and infectious disease specialist. So she mentioned that there is a story behind that there was this disgraced principal investigator of Pfizer vaccine who started this story that there is a placenta protein, it's called syncytial protein of placenta, that is same as a spike protein of COVID. So he said that can cause all those issues, but again, it has completely no base and no like sort of truth in there. Those two proteins are different, and there is no effect on the fertility proved. Similarly, in pregnancies, there have been many ladies who have received that in pregnancy, and all has gone well. They're not highlighted. So there's a vaccine reporting adverse reporting system that has a lot of self-identified contraindications. How come these are not highlighted? So it's again like sort of pretty complicated system overall of reporting, and then those contraindications, and they can like have different questions, and that is honestly speaking too much, again, the bureaucratic procedure. But from clinical standpoint, from being at the forefront in the ER and our society, we have been having like a lot of discussions on that. In ER, vaccine-related issues have not coming up, adverse effects have not been coming up, which we can say that those issues are related to vaccine. Rather, at this time, we are seeing much high spike of the patients with COVID, and almost 99% of them, when we ask them, they are not vaccinated. So that is the situation going on with not getting vaccines.
I think there's one more question before that, Sister Denise. What will happen if students are scared? You know, some kids are. Yeah.
Before I get to that one, let me just say, we have 2 fever check.
Three.
I'm sorry, that the students will be able to check their fever once they come into the school. So we have one on the outside, we have several inside. So we do have that. All students and personnel and or staff or visitors will be doing temperature checks before they enter into the main area of the school. So we do have the fever checking, yes. Let me go to this one real quick here. Okay, I already did that one. Guys, one of the wonderful things, if I have to say about coronavirus, if there's anything wonderful, we might not know much about the disease, but I can guarantee you there are some wonderful people that has books for kids reassurance that we can read and incorporate it into our classroom, just to make sure that they're not scared of, if they hear the words coronavirus, or even if someone sneezes in the classroom, right? So that's a classroom management procedure for our teachers. I don't want my class to be worried about the word coronavirus, right? But I know there's fear out there, but we will definitely utilize the resources that wonderful teachers out there has made to calm the hearts of the little ones. And definitely high schoolers can read those books too, so they're not exempt. So Insha'Allah, we will make sure that your child is not fearful, and that we are calm and collective too when we're talking about anything. So even if we had a classroom shutdown, we are not going to go into a panic. So we as teachers, alhamdulillah, are trained in these type of scenarios, not just coronavirus, but also like in lockdowns or tornadoes and fire drills. So we will maintain that professionalism, that calmness when we're dealing with anything that happens within our classroom, inshallah.
Mr. Denise, I also want to emphasize that all our teachers have received mental youth health first aid training. So they have been equipped with any and all scenarios to support their students. Two more questions. I want to read it out because I know you have answered them in the chat, but are all teachers and staff vaccinated?
Yes, so, it was a requirement for every teacher and staff to have their vaccination done before the start.
Is Sister Iman in this meeting, Sister Iman? So we have a question here about how we, I think we should wait for all virtual learning questions to be answered in the end. There's one more question, two more questions popped up, Sister Denise.
Thank you, Sister Denise. Aw, thank you. And I mean, is that what you're trying to say? You want me to read the dua? Jazakallah khair. That was fun. Do we have a specific school counselor for mental health support? Not at the moment. But one of the wonderful things that Sister Marsh said that we all, several of us has attended a mental health youth seminar where we received our certification to deal with mental health in young kids, even pre-K all the way up to high school kids. So we've taken those courses, we've taken those hours, mashallah, tabarakallah, to be informed to deal with the mental health aspect that could arise in our children, inshallah.
Sister Iman, towards the end, we have some questions that how are we going to do the online and in-person, the way we are going to offer the class. So some parents have that question. We will wait till we are done with the COVID questions. Is there anybody else? Did I miss any questions, Sister Denise? Can you double check for me?
Yeah, I'm going all the way back. So yes, we do have consent form for opt-in or opt-in and opt-out of rapid tests. So most of it now is just the school and virtual school super option for teachers. Because we're gonna be awesome when we do virtual, guys. Okay, should we start?
Yeah, is Dr. Bilal want to add a few more points?
Yeah, please. So, but just like quickly want to tell about vaccination again from 12 to 17 years of the age, which is 7.5% of the population. So far in the all over nationally, 43% have been vaccinated. So we again need to keep in mind that it is overall not bad disease in kids, but yet there have been 4 million kids who were positive so far with COVID, and some did not do good. So, and obviously one kid life is, God forbid, loss is obviously a big setback for the parents and for the community. So that's why it's, again, not to panic. Generally speaking, it has been very kind to the kids, yet COVID has its mind of its own, unprecedented action. So we just need to be be mindful of that, number one. Number two is that kids are obviously the carriers. That's why we have to be, careful that they can take from one to the other, to the parents, grandparents, and then they can get sick. So that's why the protection is not only for the kids themselves, but they are at this time, guards of the whole family, particularly when schools will open. And obviously every year there are spikes of different diseases. So when at this time, we have to keep watching not only for the kids' protection, but for the protection of the whole families. Right. So this brings to the question of masks. So again, like the CDC said, no masks. Then CDC says, again, like they said, masks. According to the local authorities, there has been a lot of political tug of war in this situation. Science, politics, all that is like sort of not hands in hands, rather locking horns. So that's confusing things. But just recently, like again, a few minutes ago, I read that article. So it says that the situation is that the viral load may be the same in vaccinated versus unvaccinated people. So if they did the study, somebody vaccinated may have the same viral load as unvaccinated. What it means is, but the people are not getting sick. 100%, as we said, in the kids, they are not symptomatic who are getting vaccination in the trial, which they did. So what it means again, that somebody can be completely all right, but without knowing, they may be taking the viral load in their nose, in their secretions everywhere. So that's why wearing masks is becoming more important again in this whole situation. And one more positive thing I would tell you, like last year during this all COVID, we were just thinking in the ER, where is flu? Because a couple of years ago, flu was like rampant, like it was so crazy. And we almost did not see flu a whole winter, which is the peak time for flu. And now we are seeing flu again, influenza, because again, we are out of masks. So obviously we cannot live like that forever, but at least at this point, masks are not only protecting from COVID, but they're also protecting from flu and from multiple other viruses. So that's why masks are recommended. They are encouraged to be completely worn all the time. And I would just suggest Sister Miraja and the RSA administration maybe to do a mask creativity competition or something. How cool is one's mask while keeping in our own values and our, the limitations.
Absolutely, that's going to be an awesome STEM project.
I had one more request, Sister Denise. One of the parents suggested like how had a classroom, teachers will give them maybe a treasure box, how well they are keeping their mask on. So on Friday, they'll receive a little gift of their, earning that reward for keeping their mask on.
Dr. Piracha, there's a question for you. It says, when can we expect a vaccination for kids under 12?
Yes, so according to Dr. Anthony Fauci's latest talk, most likely by the beginning of 2022. Even it is expected that by the beginning of 2022, it becomes mandatory. As we know that all other vaccinations, we have to, the kids have to bring the certification. So it's possible. And again, I know it will be a big political fight, but it's possible. But in any case, most likely it will be approved by the end of this year, and most likely in the next year or like following the start of the school year, it may become must that you have to bring the certification for all kids who come to the school. Because as I mentioned, there is already a big study going on, 4,500 kids from age 6 months to 12 to 11 years who are going through the trials. And they mainly look for the first 2 months, if any side effects. If after 2 months it's negative, things are good. I would quickly like to touch here a conspiracy theory or a question that this can change our genetic material. So as you saw that video, it's sort of like the DNA is in the cell. And for the kids also, it will be interesting to know that in our cell, there is a nucleus inside. And in the nucleus is the DNA where all our genetic material is sort of designed. And it's a wonderful, sometime we can have a whole lecture on that. But in any case, that's how we are defined, by our DNA. As we say, it is in my DNA or this and that. Sometimes we take it as excuse, DNA. But in any case, this is like, it's in the DNA. So the outer covering is the cytoplasm. The outer covering is the cytoplasm. So this vaccine is only messenger RNA, as we showed you the video, enter inside the cell. So the DNA is inside the cell in the nucleus, and the messenger RNA only comes out of the cell does make the cells to make the spike proteins, and that makes the antibodies, and that goes all over in the body and helps the immune system. One more thing on this one is on the vaccine, like the spike protein, that somebody can ask that I was infected, so do I really need to have vaccination again? So that they say that the immunity developed by your disease only is not as robust and not as durable as the vaccine, because it only like does for the time being, it activates your immune system and then it drops down. So that's why it's the immunity, the two vaccinations, they give you pretty long-term durability for the bodies to make the antibodies. So it's not always in our body. If we check the antibody, it may not be there. But if the virus comes, then it activates, they are called T cells. It activates the T cells, and then they start producing antibodies again. And this also brings me to the question is, when are we getting the booster shot, or when is the booster shot going to be approved? There are very high chances that the booster shot for the approved populations, like for the adults and the kids 12 to 17, that may become approved very soon, because there is a lot of data coming that even after 6 months with the 2 shots, the immunity is coming down. So there are chances that booster shot for the adults and 12 to 17 years of the kids may be approved pretty soon, within next month or so. And then we may all have to get that booster shots.
Sister Ghazala will be answering this last 2 questions we have. Sister Ghazala?
Okay, what are the questions, Sister Miraj?
The question is, did you get to calculate how many kids will be in the class? So I'm not sure if this is talking about the ratio or the class we have enrolled right now.
Okay,
and
so
will the kids have their own tables?
Okay, so the first one, so we are going to stick to our ratio. Generally, in the beginning of the school year, we may have 1 or 2 students more, but we are going to stick to elementary. It's means KG through 5th, 18 to 1. And even if they're going virtual, we'll still be maintaining the same ratio. So there won't be ratio up. And if there are more students, there will be more teachers and the classrooms will be bigger. And that should be it. For example, if you have 18 students in the classroom and there are 5 are virtual, then there will be remaining left in classroom and the 5 will be virtual. And Inshallah, hopefully, because virtual learning is only temporary, so we are expecting things to get better, and hopefully they all are going to come back on campus, Inshallah. And as for what was the other question, Mr. Murad?
Will they have their own desk, I believe? That's
okay, so first grade and up, everybody will have their own desk. Kindergartners, we try to give them individual desks, but kindergarten teacher suggested they want the round table because they are putting less students on the round table because they are very young and they still need to have some kind of social interaction, maintaining face masks and social distancing, because they will be sitting practically distance from each other.
And we are also
recommending. And Sister Denise, you are the one who requested roundtable, so maybe you can put more into it.
And we can also request plexiglass, right? For
yes, plexiglass. We already put that on the preparedness plan, and we have lots of individual tables, but kindergarten and pre-kindergarten will not have individual table. Kindergarten, they had the choice, but teacher preferred the round table because they're sitting them apart and they're making sure they're distant from,
less students per table compared to. There's our teachers divided. Okay, this is something for Sister Iman for. Okay, Dr. Bilal, do you want to see that question from Brother Gibran?
Hold on, while he's reading that, let me just answer this question. Yes, you definitely can wear the face shield in addition to the mask. There's no nothing stopping you from adding the face shield as well.
Inshallah.
So again, as a Muslim, rather we exactly that we are the Muslims are the people of research and science, and we definitely need to bring back that ideology that is not about any beliefs, only like blind beliefs. Rather, we believe in the research, and we believe in all the hard work to get things proved and then get things approved, and then we follow those guidelines. So again, definitely we will not say yes to everything, whatever is being thrown at us, but at the same time, we have to follow what are the basic health guidelines where we are living. And CDC, obviously there could be like plus and minus, that good job or not good job, but overall CDC has done a pretty good job in giving the guidelines not in a panic mode. So for example, initially they said that masks are not mandated, because they said like at that time it looked like the masks are not really required. Later on, according to the current the oncoming data, they changed the situation. Similarly, now they said first that we can shut the mask off, then they said we can take back on. So rather than taking those things as negative, I would say these things are positive, that they are not being too aggressive and they are not being too sort of lax in this situation. They are taking almost a medium approach with the good studies coming for different things. So I would recommend, this will obviously this will be again, the final question is that RSA will, I hope the RSA will not mandate the vaccine for children. This is RSA administration decision, but if it becomes from the government and all the schools are required to have vaccinations for the kids, then how can RSA stay out of it? It's not possible, and it is not medically advisable and not what is called protected environment. So again, it will RSA decision, but if everybody is going to that way, after all the research, we should go that way.
So, Denise, do you want to check if we missed any questions in the back?
A lot of them will be. So, oh, sorry, go ahead, brother.
Sorry, about there was a question before that, are we giving vaccines on the school or something? And I think Sister Denise, you mentioned not.
Oh, yes.
Yes. So I would like to just quickly mention here, I have offered Sister Miraj, and as an urgent care, we can do a vaccine drive. For example, if many parents and the kids, they want to do it, we can drive a drive-through vaccine campaign. Just you come there and we just like give you a shot in your car and let you go. And it can, again, as I said, boosters may be coming very soon. In that case, most of us will be needing that. So we can work with the Sister Raj and Insha'Allah make it very easy for all the parents of RSA to get those shots as well as for the kids.
Okay, so next question, Sister Denise, do you want to read it? Sister Ghazala will take it.
Yes, regarding the gym or PE class, are kids allowed to play together, or there will be a 6 feet distance rule applied? First, we talked about having PE outside in the fresh air, out in the open. So Inshallah, we're trying to do that if weather permits. And also the safety of the heat and cold, we put that into consideration. Now,
so also our gym has a very wide door. If the weather is not good, we'll leave the door open and they can stay inside.
Right, so yeah, so the gym will be wide, and alhamdulillah, most of the time there's usually one class anyway in there. That's what happened in the past, so they have that whole gym. Now, are they able to play together, or will there be a 6 feet distance? Sometimes these questions break your heart, right? Because, recess is one of those times where you're away from the teacher. This is their wild out time. And now we have to be like, go outside, play together, but be separate, right? I'm trying to be a realist right here. So I don't, it's going to be hard for me to blow a whistle if someone plays tag, right? We will encourage, but we're not perfect either, because, again, as a mom, as a teacher, it's going to break my heart where they're all in these bubbles, and, the one time you can play, we're saying, no, you can't do it. So what we're going to try to do is we're going to teach them as much as we can, about your safety and your feet. And we have our little zones that we're trying to incorporate. But don't get mad if we're like, if we're trying to say, hey, try to be these distance apart, but play together at the same time. So we're trying to do what we need to do to make sure that they're, emotionally understanding that, we want to have free time. We want to play with our friends, but now you're locking us down from that. So if they're outside and they're playing tag, I'm going to let them play tag. We're going to be taking hand sanitizers with us. We're going to make sure that they're still masked. And if there's different suggestions on classroom management and how we handle that. So we're going to incorporate all into that. But, you know, we want them to play together, but separate, but play together.
I would suggest in this regard, again, it's up to the RSA administration, that when they are outside, it's very less, like it's a pretty protected environment. Natural protection in there. We may not be that strict on that. Once, for example, it is raining, it is cold, they are inside, then we may be a little more watchful on that don't come too close together as much as we can. But outside, we can let our guards down. And again, the CDC, with the new recommendations, they said inside, you need to wear mask more as compared to outside.
So Lala, do you want to add anything to it?
Which one, Sister Miraj?
About kids having to keep social distancing while in the playground?
Like playground, we discussed with the teacher yesterday when we had a training that Inshallah, they will be praying, teachers were playing, and teachers will be carrying the hand sanitizers also. So Inshallah, making sure they are not touching their nose and mouth, and teacher will be telling them that make sure when you are playing with each other, when you're touching the equipment and all those things, make sure to sanitize your hands and do not touch your nose and mouth at the time, because, and also mask will be difficult at that time because they will be running around and all those. So that time they can open it because they will be outdoor, but more sanitizer use at that time.
Sister Ghazal, let me jump in real quick. And just for parents, if you want to pack more than one mask, I would highly encourage it because masks will get moist. And I would prefer, like you get two baggies, one with clean mask, one where they can take out their mask, you know, unless it's disposable, right? But they can put the dirty one back into the bag, zip it up, because if they are running, they're breathing hard, it does get moist, and nobody wants to see a moist mask. So encourage more, and we'll give them plenty of time to switch out and take proper hygiene and hand sanitizing and cleanliness at that time. So.
Okay, so Sister Dr. Bilal, do you have any points? Then we can go to Sister Iman for virtual learning.
Yes, Inshallah, I will just like
I
will just conclude, Inshallah. So just one final thing about the treatment quickly for the parents I would like to touch is there is now some treatment available, which is sort of not being that much, we are not seeing much in the media. It's called Regeneron or Regencov. This is sort of like monoclonal antibodies that are the ones which Trump received, whether we like him or not, but he did get better with that. And this is like approved. This is the only monoclonal antibodies now under EUA, Emergency Use Authorization by FDA, approved for giving to the patients, even to the kids who are high risk. And anybody above 55 can get it. It is IV infusion, as well as the latest study by New England Journal of Medicine, the household contacts of anybody positive, they can get it subcutaneous, like not even the deep injection, that's just below the skin injection. And the studies showed that it was very effective in protecting the people at high risk getting further deteriorated. So that's medicine available, and it is out of the hospital. Once somebody gets admitted in the hospital, then it's not available, and we can help in getting that medicine. One question here came up as a shield, that are the kids allowed to wear plastic shield on their mask? I think it should be all right, but again, according to the administration. But I wanted to touch the point here is that these are not interchangeable. So a brother was telling me his wife is in another school here, so we should be thankful to RSA for having a very wise policy. The principal of that school told the teachers that you should not wear masks. Rather, you can wear the plastic sheet only so that the kids can see your face. So that's how hard it is for some teachers and students in many schools just around our area. So the brother was saying that we gave them very hard reply that we cannot do that. So the thing is that the plastic sheet, it only protects from secretions directly coming, but it's not about the viruses itself. The mask, it mainly protects others from you, but as well as it can protect you from COVID and mainly from many other viruses, as we have discussed. So yes, shield on the mask, pretty good, but it is not interchangeable. Masks are must, shields are all plus. With all that, I think we have touched many points, and as I mentioned in the beginning, PCR test will be a good way to get peace of mind. We can do we can do urgent testing, vaccine drive, treatment help, all that. Inshallah, it will be player for us to take care of that. At the end of, I'll just conclude with that we just need to keep in mind again that it's Allah, everything is in Allah's hand. As Muslims, it has to be our very strong belief that there are many other things which can harm us more than COVID. People were dying before COVID. People will keep dying after COVID. People were getting sick before COVID. They will keep getting sick after COVID. And even during COVID, they are getting sick without COVID. So we have to be careful. We have to be very protective of ourselves, of others. But we don't take to the next step of getting what is called like obsessive about that. We leave our complete trust in Allah. And definitely these du'as are the shields against all the harm and tests. So, Bismillah alladhi la yadurru ma'a ismihi shay'un fil ardi wa la fis samaa'i was samiul alim. And for example, Allahumma a'udhu bika min al-hammi wal hazni wal adzi wal kasali wal jubni wal bukhli wa zala'i ad-daini wa ghalabat ar-rijal. These are all different du'as really give us the real protection. After taking all the precautions, then we put our complete trust in Allah. And then if anything is written, it's from Allah. Otherwise, Allah is there, our protector, our Razik, our Khalik. وأقول قولي هذا أستغفر الله لي ولكم ولسائر المسلمين. جزاكم الله. Thank you very much.
Jazakallah khair, Dr. Bilal, for helping us out here. Sister Iman is online right now. She will be answering questions for virtual learning related. Sister Iman?
Yes. What is the question, Sister Miraj?
Okay, I'm going back.
There's many questions about the virtual option.
Yeah, so I'm just going back. If any parent would like to unmute themselves and ask the question, please feel free to do that. We want to hear from you. We will also read the questions from the chat. So it's a question here. I went back all the way back. It says, how is a teacher supposed to manage regular school and virtual school at the same time? And I think that's the common stronger together. We can do this. I think after, mashallah, RSA did amazing last year having the virtual school. We ran it successfully. Sister Iman.
Okay, assalamu alaikum, first of all. Actually, we did a pilot class in summer and we put some staff in it. So some of the staff was online and some of the staff was on site. So alhamdulillah, there was, and our physics professor, he did that class last year. One student was on site and the rest of the students were online. And since our class sizes are small, so alhamdulillah, we're able to do it. So what's going to happen is the teacher, whatever she's going to write or he is going to write on the board or whatever communication they're going to be doing, it's going to be live. And there will be the students who are virtual, they will be able to see and communicate with the teacher. So the kids who will be sitting inside the classroom, the students who will be sitting inside the classroom, they will not be on Zoom, but only the ones who are going to be virtual, they're going to be on the Zoom and the teacher is going to be on the Zoom. The way the computers are going to be situated, the cameras is whatever the teacher will be doing in the class will be visible to the teacher. Will those children be able to present their work? Yes, they will be. And since our computers are going to be hooked to the TV, their work will be cited by the students who are inside the classroom. So just like we said that, alhamdulillah, we did it. But having said that, of course, the way we were vigilant about children being virtual children all the time involved in the class and everything, a little bit of responsibility will also be on the parents that make sure that your child is actually attending the class and is not distracted, because a lot of interaction that will be going on in the classroom, teacher will try to engage the students who are virtual too, because they're going to just treat them as the students in the class. They will be asking them questions, but at the end of the day, some responsibility will fall on the parents as well.
Iman, there's one question I think Sister Ghazala wants. I wanted Sister Ghazala to answer. Will the teacher do a recap on those missing 2 years of education? Sister Ghazala?
Okay, Sister Miraj, can you repeat the question, please?
Will the teacher do a recap on those gap,
Okay, so we did share that information in the newsletter also, that there will be kind of intervention plans and reteaching going on, especially for the elementary students from kindergarten and all the way through 6th grade, and maybe 7th if possible, but 6th grade for sure. Because when we look at the star data and everything, even though our school performed, mashallah, very well, our student is very good, mashallah, but we see from our standard that they are not there where they are supposed to be. So regardless, every single student in elementary school, first grading period, that will be up until November. What was the date, Sister Miraj? November or October? First grading period. There will be reteaching going on, especially in the math concept. Language arts, we are not so worried because language arts have 2 blocks. So that will be taken care of during the class period. But for math, we have added extra class period. In every 5 days, they will be going extra 30 minutes of math classes. And at that time also, they will be basically covering all the concepts that we think the students have not covered, because we are just doing it as a blanket that we know most of them have not approached the level that we want them to be. So math, we are heavy on reteaching because that's a concept that they are going to build upon, especially in middle school if they're moving forward, and we don't want the foundation to be weak. ELAR, mashallah, teachers are taking care of it because we have science, social studies, so that can be taken care of at the time also, because these are all ELAR heavy. But math, we have to have another separate period. And if there are students who we think that need extra support, extra help, then after school tutoring concepts will be going home too, besides whatever we are doing in the classroom. And don't worry, it's not like, okay, if they are reteaching, what will happen to the current grade level? Because mashallah, if you have noticed, by the time it's April, we have covered our curriculum and teachers generally go to do advanced work. So we have enough time to cover all those materials. And being mashallah STEM school and project-based school, we can cover several objectives at the same time and they won't be behind. Our goal is to make sure to cover everything and move forward, inshallah.
Let me piggyback off of what Sister Iman said. Just give you a reassurance. Last year, my daughter was virtual, but her class also had in-person. So just to let you know how that went from my perspective, so you can understand, when Halima was online, the teacher was also online inside the classroom. The learning was just as if she was sitting in there. There was nothing different. She learned at the pace. She saw everything on the board and everything that the teacher was able to upload online. So there was that interaction with the teacher. Yes, unfortunately, she wasn't there live, right? But she was there inside the classroom. So she was able to raise hands, talk, ask things. So I don't want you to feel like we can't do it. Because I know I made the statement earlier that we're not superheroes when it comes to us being sick, but we are superheroes when it comes to educating your child. So we will make it work, inshallah. We're just asking you guys to be patient with us, making sure you guys' internet's ready to go. And then a good thing is, and I don't think we mentioned this here, but if you were with us last year, you know how we utilize Google Classroom. So we'll keep that up handy because God forbid, we don't know what would happen, but we want to make sure that's always an easy transition back into it if needed. So alhamdulillah, rest assured that we have been practicing these type of scenarios for in-person learning and virtual learning for your child. Inshallah. There's one question I do want to ask or say, and correct me if I'm wrong, Sister Ghazala and Sister Miraj, if you are saying I want to go virtual, right? Can you bounce back anytime you want to, going into person or not, whenever the wind blows? No, we do have, if you're going to pick virtual, you have a certain duration that you have to stay virtual until you can switch over. Because imagine it from the teacher's perspective. Today you want virtual, tomorrow you want online, then you're feeling bored. The kid didn't wake up, then you call the school and say, I want virtual. It's a hardship for the teacher and the school as well. So if you are virtual, if I'm correct, right, Sister Raj, if you're virtual, we give you a grace period. Then we can switch over again once that grace period hits.
Yes, and I want to mention that in the last week's Cheetah Beats, this is, we tried as much as we can send a link to all new parents who joined after Thursday. Do review the virtual handbook. It will answer a lot of questions. And yes, Sister Denise, that we were going to ask parents that if you choose to have virtual learning option, at least go for minimum of first term. So it's not be as confusing for students or teachers. All the information will be sent by tomorrow, inshallah. Any other questions for Sister Iman? Sister Denise, can you scroll?
Let me go back down. Let me see.
So is there a question about assembly?
Yes, there was a question like, how are we doing? Oh, and I think there was one pickup or dismissal and drop off.
Okay, so let me take care of assembly, and then Sister Miraj will do the dismissal, inshallah. And so the assembly is all the teachers are going to, the assembly is going to be on the Zoom. And so all the teachers are going to play the Zoom inside their classroom. So just like Sister Denise mentioned, there is a group of students who are going to stick together. So those are the groups, is their classrooms, their immediate classrooms. So they are going to attend the assembly on Zoom inside the classroom. The speakers are going to be like, if it's Sister Nozat, or if students are going to present it, they are going to be in the classroom presenting on the Zoom, but everyone is going to hear it out. And inshallah, the azkar is going to be also played in the morning. So yes, we will still have the feeling of school. It's not going to be individual assembly for each classroom. We are going to still have the school feel to it, but at the same time, we're going to be distanced.
Okay. So Sister Majida will help me with the dismissal here. Similar to that, as Sister Iman mentioned, the assembly, we will have our Zoom, Zoom relayed for pickup. The teacher on the duty will be calling out the names. Zoom will be relayed in the classroom. Students and the teacher on duty will be sending them out. So we will be doing in that order for not to have any congregation in the gym like we used to have it before. So please cooperate with us. We will be very cautious with the drive-through for safety of our students because they will be walking from their classroom. So the duty teacher will be calling the name. So please, give us the ample time for that. Slow down, no use of cell phones. Inshallah, we'll be sending more information by tomorrow.
Sister Miraj.
Go ahead, Sister.
So there are two questions. What will RSA be cutting down anything from curriculum? In fact, we'll be adding in our curriculum, not cutting down, because we'll be doing a reteach. So it's not cutting down, in fact, adding more to the curriculum to cover all those things in one school year, whatever we have lost last 1.5 years.
I think we missed one question, Sister Denise. Will the desk be socially distant? Will the desk be arranged?
Where the what?
The student desk will be social. From what I have seen, like we are already doing that, right? The 3 feet social distancing.
Yes. As Sister Ghazala have mentioned, you'll have your individual desk, and we try to separate them as much as possible, or the classroom allows. That's number one. Number two, again, if you want your personal desk divider, you're absolutely able to purchase and or make one yourself.
There was one question
for you, Sister Ghazala.
So sorry, Sister Denise. I wanted to answer, will there be pizza sales? Inshallah, once things settle down, Sister Shay will bring the pizza sales back, inshallah. Go ahead, Sister Denise, for the next question.
Yes, pizza is always cool. Sister Ghazala, this one's for you. Has the school explored any of the hybrid models? For example, kids can do a couple of days in school and the rest are at home.
Okay, so we are not going to do blended this time because blended is very confusing. And also if you look at it, virtual is something that almost every school is taking risk at this time, knowing that governor did not approve it. So mashallah, alhamdulillah, we are private school. We have too many leeways that we can even mandate masks because that is a private institution, not the government one. But we are asking everybody to highly requiring the mask. But no, we are not doing blended this time. We are just giving them temporary synchronous virtual learning, but no blended.
Let me answer this question out loud because I answered it in chat. Again, I want to stress out, if your child is sick, whether positive or negative, stay home and immediately contact the office so we can begin the virtual. So the virtual schooling. So your child will not miss out for that duration that they're home. So yes, you're sick, call the office, right? And let us know. And the good thing is, alhamdulillah, we'll all be on Zoom. So it would be easy for them to utilize that virtual option so nothing will be missed.
Inshallah. Any other questions?
It's almost Maghrib time now.
Yes. So, Jazakallah khair, Sister Denise, all our parents, staff, inshallah, we look forward to seeing you all tomorrow.
Sister Miraj, is there going to be any after-school activities?
We are working on it, but due to, again, keeping safety in mind, we want to settle down and, once we start school, we'll bring them as much as possible with safety in mind for all. Jazakallah khair, Sister Denise. Inshallah. All right. Assalamu alaikum, everybody. We'll see you tomorrow.
And Sister Iman is still there. She can make dua.
Sister Iman, Sister Aziza, anyone? Please make
Inshallah, I'll make the dua. Okay, as the dua, always we say dua, inshallah. Let's also add another dua. Allahumma inna na'udhu bika min al-barasi wal-jununi wal-judham wa min sayyi al-asqam. Inshallah, we ask Allah subhanahu wa ta'ala, we seek refuge in Allah subhanahu wa ta'ala from leprosy, madness, and all evil diseases, inshallah. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. السلام عليكم.